Hi, my name is Dr. Alejandro Gonzalez. I'm here in the city of Southgate. My clinic is Loyola Family Health Center. We're located at 4225 Tweedy Boulevard in the city of Southgate. I've been in practice for 30 years. I'm an internist. I take care of patients that have chronic disease. I love to emphasize that I work with patients that are diabetic, high blood pressure. I have a passion for treating patients with obesity. So obesity is defined as the measure of your body mass index that's been elevated. So you have obesity being body mass index of over 27 if there is any kind of what's called coexisting or comorbid conditions such as diabetes or hypertension. If you don't have diabetes or hypertension, then we consider obesity body mass index greater than 30. The causes for obesity most of the time is what's called exogenous calories, which means people overeat. They overeat and then there's a lack of exercise. So the combination of calories coming in and calories coming out is out of balance. Now there's other causes for obesity as well too, where you can have some endocrinology kind of obesities where you have your thyroid that stops working. Therefore, your metabolic rate goes down. That causes you to gain weight. People also gain weight possibly because of being on any kind of steroids for medical treatment, for example, of autoimmune diseases or asthma. So obesity causes other issues. Obesity in it by itself is a medical diagnosis, and it should be treated just like we treat high blood pressure and diabetes as a chronic disease. Obesity, however, will also contribute to other problems. For example, obese patients may tend to have a higher prevalence of diabetes, may have a higher prevalence of hypertension, and also may have higher prevalence of certain type of cancers, including colon cancer. Obesity in itself, again, needs to be considered a chronic disease and should be treated as such. And there's various treatments that are now available for the management of obesity, along with your diet and exercise. So there are various treatments for obesity. The most important thing is to obviously discuss it with your primary care provider so you can figure out what is the best treatment for you at the time of the diagnosis. The first thing that we usually do is tell patients that they need to eat a healthy, balanced diet along with increasing their physical activity. That's always a staple of pretty much any disease that we like to treat, including diabetes and hypertension. So it's very important to choose wisely when it comes to the foods that you're eating, balance it with good, healthy options, fruits and vegetables, lean cuts of meat, avoiding a lot of the carbohydrates, simple sugars, avoiding the breads, the rice, the tortillas, the white floury kind of foods, because those tend to convert and change into very high carbohydrate rich foods that will affect not only your blood sugar, but it will also cause the weight gain, and also at the same time increasing activity. Typically somebody who hasn't been active, we don't want them to just begin running a marathon. We want them to slowly start, and we usually introduce walking as our method of weight loss. So we recommend walking maybe 30 minutes a day, and then slowly increasing your endurance. So those 30 minutes, rather than maybe walking a mile, you're able to walk now a mile and a half, and then slowly you're walking 2 miles within that period of time, so that you're increasing your activity. Along with diet and exercise, there's various medications that can be used for the management of weight. There are older medications that we use, which a lot of people may have already been aware of, like phentermine, and then there's newer medications that are now available, which are medications that help the body feel the fullness, decrease the gastric emptying, and therefore help with weight loss. This is one of the newer products that's out there, which is called either Saxenda or Wegovy. These are what are called GLP-1 medications that are very effective and have shown to be very promising for weight loss. Now, I want to talk a little bit about some of these fad diets that are out there. One of them is the orange peel diet, that you boil the orange peel and then you add some maple syrup and things like that. First of all, they're not balanced in any which way, because you have to fast for a very, very long period of time and eat very, very little calories during that period of time. It's not sustainable. It's not something that's healthy, and it reduces, if anything, water weight, and you're not really losing any fat. You may be losing actually protein from your muscles, and then that's actually counterproductive. The same thing goes with some of these diets that you take, these herbal pills, and they put you on a very low calorie diet. Again, a lot of these are almost acting as what's called a diuretic, which is enough just to get the excess liquid out of your body. And again, you're losing the water weight. It's not sustainable as far as long term. It can be detrimental in the fact that you're losing some, protein versus, actual fat. There is the intermittent fasting, which is actually not a bad option. The most difficult problem with intermittent fasting is people just tend not to be able to stick to it for a very long period of time. So if you're that person that's able to do it, that's fine, as long as when you do eat, you eat a balanced diet. You don't want to just intermittent fast and then just go crazy the time that you're able to eat, because again, you won't lose the weight. The other diets are the ketogenic diet, which is also very good. We do have patients that are on the ketogenic diet, especially some of our diabetics. They tend to do well with the ketogenic diet. The only issue, again, is being able to stick to it. I always tell patients the diet that you can stick to is the diet that's going to work for you. But again, it has to be a balanced diet. So even in ketogenic, which is avoiding a lot of the carbohydrates, a lot of people think, well, all I'm going to do is eat, bacon all day long. That's not healthy. So you need to balance your type of protein that you eat, so you're minimizing a lot of the excess fats, but yet eating leaner protein. You can eat more of that leaner protein, but again, it has to be very balanced so that you don't end up hurting yourself in the process. Hit the subscribe button. I'll be giving you tips every month. I'll try to bring out educational information as often as I can, and I'm here to help you and the community.